any I'm a Celebrity fans or Bake Off fans with us this evening. So firstly, I'd just like to thank you for joining us. I imagine you've had a fairly busy, very busy day in community pharmacy, so thank you for that. For those of you who don't know me, I'm Laura Dunkley. I'm the Operations and Contractor Lead at Community Pharmacy Lancashire, so your LPC. With me tonight as well is Mubashir Ali, our Chief Executive. We've also got Alison and Emma, and I'll hand over to them shortly. But the idea of this evening is just to give you more information about the Smoking Cessation Service, which hopefully you've all signed up to, and fully prepare you really for these referrals that will start coming through as of next week. The plan is that referrals will start trickling through from both Preston and Chorley sites as of Monday next week, the 14th. So it's all pretty much go. In terms of housekeeping this evening, if you could all, I think you have done, pop yourselves on mute just so that we can hear the presentations nice and clearly. And if you have any burning questions, by all means, feel free to pop them in the chat. But we have got a designated, allocated slot towards the end for any questions, and hopefully your question will be answered in the presentation as we go along. So without further ado, I'll hand over to Alison. Thanks, Alison. I'll just get these slides up.
Thanks, Laura. We've just got somebody in the chat saying they're having an issue with sound. I'm not sure if I always struggle with these technical type questions that people ask.
Good point.
Bit of a challenge with Teams. I don't know if you can turn the volume up maybe. The sound was coming through okay for me. Was that okay for you, Emma and Bash? Did you hear Laura okay from your end?
Yeah, that's fine here.
Yeah.
Okay.
Maybe something to do with your system rather than with the way that the presentation's been. There you go. Press the speaker button and put on loudspeaker. I had the same issue. There you go. Thank you very much, Ibrahim. That'll be helpful.
Thank you.
Super.
Our agenda's just there for this evening. Obviously, I've done no introduction, and I'll get your slides up now, Alison. Won't be a sec.
Thanks, Laura.
Here we go.
Super. Thank you.
Give us a nod when you're ready for the next one.
I will do. Thank you.
Thank you.
So thanks very much for having me this evening. My name's Alison Scowcroft and I am Senior Medicines Optimisation Lead for Midlands and Lancashire CSU. The Midlands and Lancashire CSU have been commissioned by NHS England to facilitate the implementation of the Smoking Cessation Advanced Service across the whole of England, and my role is supporting the North West, so Lancs and South Cumbria, along with Cheshire and Merseyside and Greater Manchester. Next slide, please. So I'm just going to give you a little bit of a background to the NHS SCS service, tell you a little bit about the pilot that we had back in 2020, 2021, which led to the national commissioning of the service, and then give you a bit of an update around the national implementation. Next slide, please. So I'm sure everybody on the call is aware of and has heard of the NHS long-term plan, of which prevention is a core component. So the long-term plan commitments set out the NHS's contribution to tackling tobacco dependence, and particularly they include that by the year 23-24, all people who are admitted to hospital who smoke will be offered NHS-funded tobacco treatment services, and that includes acute trust, maternity trust, and also mental health trusts. So these commitments are designed to be the NHS's contribution to helping to deliver a smoke-free generation. They build on that good work that's already being delivered and are intended to complement existing stop smoking services. So there's a focus on both physical and mental health services, and it introduces a level of national direction with a national commissioning of the services, but with a local development and implementation. Next slide, please. So we know that smoking cessation programmes already exist in community settings, but they do vary in terms of their involvement of community pharmacy. The way that the hospital treatment services are working, and I'm sure Emma will go into this in a little bit more detail, is that they're adopting the Ottawa model of smoking cessation. And that needs to be adopted throughout England as part of the long-term plan. It's a 12-week programme and it does require follow-up of smoking cessation treatment after a patient is discharged from hospital. The data shows that the Ottawa model of smoking cessation increases the 1-year quit rates by 11%. And they reckon that this is going to save the NHS £85 million within a year, which is a really big number. But I think we're preaching to the converted with a team full of pharmacists who understand how important it is to stop smoking in terms of financial as well as health benefits. Next slide, please. So the aim of the NHS Smoking Cessation Service is to support the delivery of the prevention ambitions in the NHS long-term plan, and also for community pharmacy to become a nationally available choice for patients to access smoking cessation support after discharge from hospital. Next slide, please. So, as I mentioned earlier, there was a couple of pilots which were run by the Pharmacy Integration Fund back in 2020 and 2021. I was personally involved in the Oldham pilot, so had some really good experience to help out in the role that I have currently in supporting the rollout of this service. So we had an expression of interest process in the Oldham area of Greater Manchester to identify pharmacies who wanted to be involved in this pilot, making sure that we had good geographical coverage and extended opening hours. So we went with a cohort of 12 pharmacies in the Oldham area who started to receive referrals from the Royal Oldham Hospital back in December 2020. There was a second pilot area which went live a little bit later in November 2021, and that was working with Guy's and St Thomas Hospital and King's College Hospital into the Lambeth and Southwark boroughs of London. Once those pilots had completed, then there was an evaluation that was completed by Midlands and Lancs CSU, and that evaluation has supported the national commissioning of the service. Next slide, please. So just to give you some numbers, some people really like the stats. So this is an overview of some of the data from the Oldham pilot that I mentioned. Just over 200 patients were referred from October 2020 to December 2021. And of those, 81 patients enrolled into the programme with the pharmacies. So that's a conversion rate of around about 40%, which is in line with what we were expecting to see. It's in line with referrals from trusts into community services. We had a 4-week quit rate of 57%, which is absolutely fantastic. Again, statistics in line with other services. And our 12-week quit rate was 23%. It is always a little bit more difficult to keep people engaged with the programme through to 12 weeks. But usually what we see is the patients have quit and they just don't continue to receive the support for the full 12 weeks. So some really good statistics from that Oldham pilot. But the pilot wasn't really about community pharmacy proving that it can deliver a good quality stop smoking service. It was all about the transfer of information and that electronic transfer of care. Next slide, please. So, as I mentioned, the pilot then transitioned into a nationally commissioned service. The National Centre for Smoking Cessation and Training, NCSCT, have developed a specific standard treatment programme, which is just for the SCS service. It's a really valuable resource, and every pharmacist or technician shortly who's going to be delivering this service really needs to familiarise themselves with that standard treatment programme. The funding for the service was agreed between PSNC and NHS England, and the consultation fees for the service are being paid nationally through the Community Pharmacy Contractual Framework, with the NRT costs recharged back to the ICB for which the patient is registered. Obviously, the service specification was updated and agreed between PSNC and NHS England, and there was a soft launch of the service back in March this year to align with National No Smoking Day. So that was an intentional soft launch because clearly it takes some time to work with trusts around the system to support them with setting up the referral pathway. Next slide, please. So in terms of the national implementation of the SCS service, the CSU has a role initially in scoping and mapping, so understanding the position of each trust in terms of their delivery of the relevant parts of the long-term plan, so where they're up to with implementing their tobacco dependence teams, and then identifying key stakeholders to support setting up working groups. We then facilitate the implementation at a local level, so there's an advisor available for each region, focusing on supporting those pilot sites to transition successfully, and then engaging with trusts who are early implementers with their tobacco dependence teams. And we do produce a range of supporting documents and materials to help with the implementation of the smoking cessation service. Next slide, please. We've got a 3-stage process to go live. So the first stage is scoping and mapping, getting all the right people around the table, setting up those working groups. Then we look at agreeing the pathway. So there's a couple of options for a trust as to how they're going to send those electronic referrals, and we work with the trust to identify which option is best for them. Then we move into stage 3, which is engagement with the community pharmacies in the area and agreeing the go live date, which is where we're at tonight. So the purpose of the session tonight, as Laura mentioned earlier, is to give you that bit more information about the service, but also to make sure that we've got good coverage across the geography for Emma and her team when they start to make referrals out into community pharmacies. Next slide, please. So the pathway is very simple. There's a hospital inpatient who is undertaking a supported quit attempt. Emma and her team will identify those patients. And then at the point of discharge, if that patient wishes to continue their quit attempt after they've been discharged from hospital, they can be referred either to a locally commissioned service, to a community pharmacy under the SCS, or they may opt for self-care. So there's no transfer of care, but the patient wishes to continue their quit attempt on their own. Next slide, please. This is the model of care. So it goes into that discharge pathway just in a little bit more detail. And hopefully you've seen this because this is included in the pharmacy service specification. So the red boxes at the top are Emma and her team supporting that patient whilst they're in the hospital. The blue boxes in the middle are all about that transfer of care. So the patient's designating a pharmacy to receive the referral and continue the treatment upon discharge. That referral is then sent, and then contact is made between the pharmacy and the patient within a 5-day window post-discharge. And then we move into the green boxes at the bottom when the patient registers with the pharmacy and fully transitions into that 12-week programme that's delivered by your pharmacy. Next slide, please. So I thought it would be useful to just pull out a couple of aspects from the service specification for community pharmacies that are really important for you to be aware of. So this service is intended to complement existing locally commissioned stop smoking services. It's not a replacement for them. If you are commissioned to deliver a local service, you will continue to deliver that alongside the SCS. The difference is in the SCS, you could only see patients who've been referred from the NHS Trust. Whereas in your locally commissioned service, you can recruit patients into that service yourself, and you may well receive referrals from other places. But for the SCS, it's just for patients who have been referred by the trust. It's really, really important that you contact the patient within 5 working days of receipt of the referral. You must make at least 3 attempts to contact that patient, and the 3rd attempt must be on the 5th working day after receipt of the referral. This is really important because we know that post-discharge period is a bit of a risky time for a patient who's been discharged. They may only have been discharged with 7 days worth of NRT, so we don't want them to run out of their products. So it's really, really important that you pick that referral up in a timely manner and make contact with them within that 5 working day period. You'll provide support for the patient for up to 12 weeks. Your consultations can be delivered face-to-face or remotely, but they shouldn't be any more than 2 weeks apart, so you can do it weekly or fortnightly. And your NRT supply, again, a maximum of 2 weeks at a time. And there is an agreed list of products in the drug tariff, so please make sure that when you're making a supply of NRT, that it is in that included list in the drug tariff so that you'll be reimbursed appropriately for it. Next slide, please. You do need to make a clinical record of all service activity. Farm outcomes is one of the options that you can use. It's probably one of the only available options at the moment, and I know colleagues in other areas are using farm outcomes to record their data. If you're delivering your consultations face-to-face with the patient, then you should be using carbon monoxide monitoring using a monitor which is on the PSNC approved list. There are no charges to patients at all, even if they pay for their prescriptions. So you're not needing to deduct any prescription charges from any supplies of NRT that you make. Patient level outcome data does need to be returned to the referring trust and to the patient's GP. Now, I want to just point this out really clearly to you that unfortunately at the moment Farm Outcomes is not doing any of that reporting for you automatically. So you do need to make reference to the appendices at the back of the service specification, which goes into detail of what data you must send back to the referring trust and to the patient's GP. And then just to give you a little overview of the fees, there was £1,000 setup fee that was paid when you registered via the BSA, and that was to cover the training for delivery of the service and the purchase of the carbon monoxide monitors. Your initial consultation with the patient will be £30, and then your interim consultations then are £10 each, with the last consultation being £40, and that can be any time from week 4 to week 12. Again, your claiming process is a manual process. There isn't currently an API set up to make this claim automatically through Farm Outcomes for you, but it is being worked on. So please make sure that you are submitting your claim manually, and all the information is on the BSA website with the claim form as to how you do that. That needs to be sent by email on the 5th of the month. Next slide, please. In terms of training, hopefully everybody who's on the call has already registered for the service and will have completed this. If you haven't registered, these are the things that you need to do. So you need to have your pharmacist and perhaps technicians in preparation for when they are able to deliver the service in the next couple of months need to complete their NCSCT Stop Smoking Practitioner certification. If you're already certified for the locally commissioned service, then you don't need to repeat that. But if you haven't done it, then you do need to complete that. It does take a little bit of time, so don't leave it till the last minute. You also have to complete some specialist NCSCT e-learning modules. There's one around mental health conditions, one around pregnant ladies, and one about using e-cigarettes. So you have to complete those 3 as well. As I mentioned before, you need to also read the NCSCT Standard Treatment Programme, and I would print that out and have a copy of that to hand when you're delivering patient consultations. It's a really, really good resource. And you need your carbon monoxide monitor and a standard operating procedure in place. Next slide, please. So in terms of in your area, we've already got Blackpool Teaching Hospitals live with the referral pathway. They started back in July. And we're in discussion with University Hospitals of Morecambe Bay and East Lancs. So really good progress with SCS in your area. Next slide, please. And this is just a little map to show the pharmacy registrations. I think this may be as of last week or the week before, possibly. The green ones show where the pharmacies are live and are accepting referrals from Blackpool Teaching Hospitals. And then the amber ones will be switched over to live, or some of them, once we get Emma's team live at Preston and Chorley. Next slide, please. So as I mentioned, Blackpool's been live since July, and we've got the 14th of November next week for the Preston and Chorley sites to go live. So I'm sure Emma will give you lots more information about that. Next slide, please. Just some references at the end there for you. I think there's been some links also put into the chat box, so please do have a check of those. That will be really helpful for you. I'm going to hand over now back to Laura, and obviously hang around for any questions that there may be later on. Thank you. You're on mute, Laura.
Thanks, Alison. Yeah, we're on Emma's slides now, so over to Emma.
Hiya. So my name's Emma Dermody. I'm the lead for the tobacco and alcohol care team at Lancashire Teaching Hospitals. Just to give you all a little bit of background on the team, we went live in July. Prior to that, we were the alcohol liaison service. So we were delivering a service to patients who were dependent on alcohol or drinking at harmful or hazardous levels. Obviously, there was the opportunity to develop a team in the hospital with the funding that came along with the long-term plan and all of that. So we, I think they decided in the trust that it would be a good idea to expand our service as a service who already deliver interventions to patients with an addiction, And obviously our referrals at the time were going through the roof. So the funding came in really handy. We have 2 more clinical nurse specialists and 3 tobacco and alcohol advisors. So as I say, we went live in July. We weren't fully staffed at that point, so we went live at RPH in July and then across to Chorley from August. And we've seen referrals increase month on month since then, really. So the new pathway for admitted smokers is to support the implementation and delivery of the following things, really. So all patients who are admitted to the hospital should be asked whether they smoke, and that should be recorded in the record. They should be offered immediate nicotine replacement therapy to alleviate cravings and withdrawal symptoms. As we know, as soon as somebody identifies somewhere to go and smoke to relieve those symptoms, we've lost a window of opportunity there. They will keep returning back to that place where they feel comfortable having a cigarette outside, hidden somewhere. All smokers should be offered specialist support through our service, and we do a range of things, motivational interviewing, behavioural change support, the pharmacotherapy treatments for tobacco addiction, and then offered further support and appointments on discharge. So the aim of all this, as well as to support smokers who might want to make a quit attempt, is also to look at making sure that the hospital and its sites are completely smoke-free. It is law, but as you know, anybody who visits the hospital regularly will know there's, you only have to walk outside the front doors to see that people are smoking outside. So it means a huge cultural change, I think, for all staff and visitors, but that's high on our agenda as well. So even smokers who don't want to attempt a quit attempt are encouraged to use nicotine replacement therapy so that we can look at pushing the smoke-free environment, really. Next slide, please. So this is what the treatment pathway looks like, and I'm just going to break that down a little bit. Next slide, please. So this is for this part of the pathway is for the admitting team, and this is where the Ask, Advise and Act comes in. So when I say admitting team, this is when somebody who has attended A&E or comes in as part of a planned admission goes through the medical assessment that's completed. So there is a clerking pro forma online as part of the medical admission, which includes the smoking assessment. So at that point, they're asked whether they smoke or not. If they do, there's further questions asked about how much, how soon after waking do they have the first cigarette, and obviously some gauge of whether or not they would like to quit, and whether they want the support to do so from our team. They're given some brief advice at that point, and they're offered and prescribed a nicotine replacement. The whole point, as I said before, is to try and encourage people not to go and find that place to smoke on the hospital grounds. Next slide, please. So the prescribing pathway looks a little bit like this. So for anybody who's identified as a low-level addiction, less than 10 a day would be offered a short-acting nicotine replacement therapy, so the lozenges, an inhalator, or the microtabs, which I don't think we've got at the minute. Next slide, please. Moderate smokers are those smoking 10 to 19 a day, so they're offered the longer-acting nicotine patch plus a short-acting NRT as well. Next slide, please. The high-level smokers, 20 or more a day, they're offered the higher strength patch and along with, again, the short-acting NRT. Obviously, these pathways can be quite fluid, and often patients have tried to quit before and may have tried some of these therapies and might say, well, actually, no, I definitely don't want a patch, but I will try the short-acting therapies, and that's even those who are smoking 20 a day. So you might see that people are not always prescribed, exactly to these levels, but we fit everything to the patient's need and request, really. Next slide, please. So the next part of the pathway is around our team and the interventions that we offer. So we obviously are looking at how ready the patient is to quit, how motivated they are. Because obviously what we don't want to do is force interventions on a patient who isn't ready and who doesn't want them, because we all know that, it's likely to fail at that point. We tell them what information, what support there is and what information there is available to quit. We discuss withdrawal symptoms and the NRT options. And if they have been prescribed NRT on admission, we look at whether or not that is meeting the needs adequately, whether we need to make any changes to that. They're offered some behaviour change support, motivational interviewing type interventions, and the discharge plan is discussed with them and agreed for any follow-up. We often go back and see patients again and again, just to make sure that they are on track, and review how they're doing on their NRT. Next slide, please. So the tax specialist assessment form is extremely brief. It's not designed to be anything other than information on how much a patient is smoking, whether they've had a quit attempt in the past, what they've used, how motivated they are. I think I've broke it down actually in the next slide. Yeah, so it's there to determine the most appropriate pathway for the patient. Next slide, please. We'll review what's been prescribed on admission. We check symptom relief. We've got 3 of us are prescribers in the team, so we can help make any changes to the prescription that might be needed. And as I said before, we really do look at motivation, because what we don't want to do is flood services with referrals that are not going to then engage, because that's not good for anybody. It's not good for the services, and it's certainly not good for the patients, who might see that as a failure, really. Next slide, please. So the third part of the pathway is around the discharge. So we send patients who wish to continue with NRT on a week's supply, and we refer either into the quit squad, or, as from next week, you guys. They're also offered, if they do decline those options, they're offered support in the form of a phone call from our service at 4 weeks, but we've not really had much uptake with that at the moment. Yeah, and we're hoping that just adding the community pharmacies into it as a discharge option will just give patients more choice, and might encourage them to engage if they've got a local pharmacy that they're used to attending. Is that the last slide?
I think it might be. Oh no, there's one more.
Oh, I think that's back to the beginning, that one.
All right.
What I was going to add a slide in with some data. But we haven't officially had anything back yet, but we have been keeping our own data. So what I can tell you is, so comparing September and October, so we had, I think we had in September 321 referrals that we saw, with 16.9% of those referrals referred into Quit Squad. So in October, we saw quite a significant rise, and we saw 429 patients, 42% of which were referred into Quit Squad. So I don't know if that gives an idea of maybe the numbers that we're seeing. I think we're probably going to see a rise again in November, and hopefully referrals into you guys, really.
Great. Thank you, Emma. That's really helpful, those numbers.
Which
Oh yes, right, back onto my slide. So I'm just going to take you through just a couple of points around referrals. Just to please be aware that referrals that will be coming from Preston and Chorley hospitals will be coming to you via NHS mail. So that's your NHS shared mail inbox. So this is going to need regular check-in to make sure that you haven't missed any referrals coming in. And we've agreed that the Cute Trust will just pop a read receipt on there so that they're aware that the pharmacy has picked up that referral, and they know you've obviously received it. And that bottom email address, if you will, is where the referrals will be coming from. So just take a note of that. I can always circulate that after tonight's event, but just be aware that that address will be where the referrals will be coming from. On to supporting patients. Alison mentioned this a little bit earlier. You're going to have to create manual reports. We are looking at using some kind of electronic platform to be able to assist you with this, but at the minute, as they're coming through via NHS mail, you are going to have to create manual kind of data keeping for this. There is a possibility that you can use farm outcomes, but unfortunately at the moment in time reporting can't be done automatically by that system. And onto service claiming, you'll need to submit manual reports again for this for payment, and these will be made via the NYS portal. And Alison explained briefly before that these should reach the BSA by the 5th day of the following month after the completion of the SCS. And I think we have covered everything now. We have got an opportunity for people to ask some questions. I think I'm just going to take the slides down so we can see everybody. There we go. Brilliant. Has anybody got any questions? Have we got any come through on the chat actually, since we've not been able to see with the slides up? I don't think we have.
No, I've had nothing come through on the chat yet. I have added several links, which hopefully make a little bit easier. A couple of templates, a couple of bespoke templates for GP notifications. I've also just added the latest sort of PDF, if you like, for a sort of a written documentation. It just makes it a lot easier. It follows a standardized format you've done your training in. You can be slightly amended with a couple of builds to incorporate the sort of fortnightly sort of review. So hopefully that makes it a bit simpler. But so far, Laura, no other comments. So I'm sure they're going to get their hands up now and start to ask loads of questions.
Anybody got any questions at all? Deadly silent. Everybody wants to get off and watch the Bake Off, I think.
I would take that as we have delivered a very comprehensive presentation and we've covered absolutely everything that anybody could possibly think of, and we've done our job well.
Brilliant.
Emma's got a hand up. Emma's got a question.
Oh, Emma, I think
Not
you're
a
on mute.
question,
Oh.
not a question really. It's just to say, when I meant to put this in the presentation. So when we send the emails, with us not having a .NET secure email account, when we send secure emails, we have to send out instructions as well on how to open it. And I think it involves registering with the secure email people. But once you've registered once, I think it should then work again the next time. So I don't think it's too complex, and obviously we will send out those instructions with each new service that we use. Just
That'll be helpful. Thanks, Emma. Great. Well, if we've not got any more questions, I think we can look at wrapping up for this evening. I will follow up with everybody that's attended today, and obviously everybody else that has registered and possibly wasn't able to attend this evening. And if anybody does have any further questions, you've all got my email address, so please fire them my way following tonight. Thank you very much.
Thanks, Laura. Thanks, Emma.
Thank you. Thanks.
Best of luck for next week, everybody.
Thanks, ladies.
Thank you.
Thank you.
Bye.
Bye bye.